I would like to say that this grant can come at no better time because of recent times, Georgetown Public Hospital, especially in my department, nephrology, we have been seeing a lot more admissions with kidney disease, and more so to start dialysis, because there are more awareness. And we have been trying to share this information, and the numbers will be increasing a lot more. So this grant is of essence, and it will be very, very, very beneficial for you, our beneficiaries. One of the most frequent reasons why patients are admitted or dialysis patients are admitted at GPHC is because of financial constraint. 50% of my patients that are admitted there are because they don't know where to go next for the next dialysis session. I will discharge someone from the hospital doing dialysis, and they will return because the finance is not there to continue it. And there are a few parameters I will try to touch on so you can keep abreast to know what is it that you're trying to achieve when you're doing dialysis. Of course, with proper and frequent assessment, we try to manage with the constraints that we have how we go about scheduling your dialysis sessions. As I said, many of you are twice weekly and you manage, but the quality of life you are living, you know yourselves if it's enough or not. And this brings me to the next, or one of the vital assessment that needs to be done. You need to be following in a clinic, and you need to be assessed properly by a qualified healthcare worker who could see what's going on with you. It's not just about doing dialysis alone, but you need to know, is it doing something beneficial for you? Because and some of you can confess to this, that doing dialysis also have a negative effect on you. Instead of it to help you, instead you find yourself deteriorating more and more. And is it that, do you need to do more quality dialysis? And here, I would like to put out a challenge to our dialysis healthcare staff. In the different centers, and one thing I would want to see we act more on is expand on education. Because if our patients know that what they need to achieve with dialysis, then they will try to do the best that they can do. Because at the end, they are the ones to benefit from dialysis. Sometimes it's good to ask yourself some reminder question, and I mentioned this. You want a better quality of life. You want to be as independent as you can. You want to be that normal person again. And it all comes back to you have to get a regular checkup. It's recommended that you follow with your doctor at least twice every 2 months and get regular checkup done. Dialysis is not one constant treatment that you do over and over all the time. It requires regular and frequent assessment. Even when you are at the dialysis center, your doctor should be checking in you to see how things are going there with you also. The other reasons why you want to do quality dialysis. Dialysis is meant to be a temporary treatment. In the first world country, dialysis is just a temporary bridge to the ultimate treatment of having a kidney transplant. Now, for you to have a kidney transplant, you need to maintain a healthy state as possible. Whether it takes a few months or a year or two for you to get onto that transplant program or get a transplant, you need to maintain a healthy body as long as you can, because you want to get a new kidney and eventually have a better quality of life.
I would like to only highlight the fact that this initiative is, in fact, is very important because facilitates access to services that all of you beneficiaries of dialysis services require. And it's very important. I want in name of PAHO, I want to commend the government for this initiative. I see from the work we do with the ministry and technical cooperation we provide that this is only a part of a large initiative that aims at strengthening access to health services, especially for patients in dialysis in this case. But as I see, I want to highlight the fact that we are seeing one of the different initiatives that we are supporting to the government of Guyana. We are actually right now supporting the government as well in the strengthening of the quality that, as Dr. Baran said, we are going to support the government of Guyana and the Ministry of Health in the standardization of authorization and supervision of dialysis centers. It is something that, as was mentioned before, it's important that as time as you, beneficiaries of the services, know what are the treatment you have to follow, the treatment provided is also of quality. And this is something that we have been committed to the government and we are going to support in the coming months. But it's important at the same time to know that, as Dr. Baranda said, dialysis is it's a part of a complete diagnostic. It's kidney disease, it's kidney health. And it is part, I also know, we see that the government just 2 months ago, the government approved a new organ transplantation act, which is something that is putting Guyana at the level of other countries that are committed to expand services. It's a very important piece of legislation that allows the country to standardize and also to provide access to services to those in need. And it's important also because it's going to clearly establish what are the procedures and what are the treatments and treatments after surgery about organ transplantation. It is really it's a very important piece in the Caribbean and also in the Americas that we want to highlight because it's a very bold step towards expanding access to kidney health and renal services. It's something that I want to highlight as well. But also very important is how the government has also taken initiative to create a diabetes center. It's also very important how this kind of services are going to prevent kidney disease and is going to increase screening of patients, is going to increase access to preventive services in the same way that the government is expanding the HEARTS initiative for primary health care, which aims at expanding all the services for chronic diseases at primary healthcare level. This is something that we are seeing with a lot of expectation how this is going to expand in this year, in the coming year, because it's going to be of direct benefit to all of you. It's important as well how the country right now it's strengthening hospital care, which is going to be of benefit to all patients that have complications related to diabetes and also related to dialysis and kidney health. I don't want to take a long time, just I wanted to say that PAHO is really working closely with the government and the Ministry of Health to ensure that these services are reaching all communities, that these services are put close to you, close to the communities, and can reach all regions in the country. The idea of having a strong primary healthcare services plus expanded hospital care is something that we in PAHO we are going to support decisively in the country. Thank you very much and congratulations.
I know I can speak for my mother when I say we are beyond grateful for this grant. Dialysis comes with a whole host of complications and needs and requirements, and it really takes a toll on someone's entire lifestyle, their physiology, and when you add the financial burden to it, it can really be very challenging. So we're very grateful for this grant because that is one less thing to think about. This will cover about 40 sessions for my mom, and I know that she's beyond grateful for this. We're really thankful that the attention has been paid to dialysis, and when I listen to the speeches from the different presenters today, I realize that there's a complete and absolute understanding of the challenges dialysis patients face. And I really am confident that, we will continue to see initiatives addressing all those challenges. So this has been an amazing and excellent step in the right direction, and it's really going to be helpful to so many persons.
Well, first of all, I would like to thank the government for it, and it will benefit me in terms of the transportation because I'm from West Coast Berbice and the fee for the transportation is very expensive. It's almost 10,000 every other day because I take dialysis at 5G and sometimes, well, most of the times because I'm traveling with lupus as well. When I'm not feeling well, we'll have to go to Georgetown Hospital. So when we go there, we'll have to take a taxi, then go to the center. So that is one thing. And then as well as the diet, because our diet is very strict. So it will really help a lot.
I am Dr. Nyamike Griffith, and was said before, I'm not here as a doctor, but as a person who has lived with chronic kidney disease for a number of years, and I've been asked to share my experience with you. So, when I was about 20 years old, in my third year of medical school, I was diagnosed with chronic kidney disease. And I found out because I just did a general checkup and I found out that my kidney functions were off. So after more investigation, I was diagnosed with chronic kidney disease. And as most of you know, it is not reversible. That means that the damage is already done. So at that time, the mode of treatment was just to slow the progression of kidney disease. So to prolong the time to which I would eventually reach end-stage renal disease and have to do renal replacement therapy. So about 6 years later, in 2020, I was in the height of the pandemic. That was when I started to become very sick. I lost weight. I had lots of appetite and nausea, which most of you have experienced before, I imagine. So it had then become time for me to start dialysis. And I was on dialysis for a few months, about 6 months, and then I was fortunate enough to receive a transplant right at the Georgetown Public Hospital by the vascular and transplant team led by Dr. Kishore Prasad here. And my donor was my little cousin, who's more of a sister to me. Her name is Yanis Abrams. And we had a very smooth transplant process there at the Georgetown Hospital, I must say. And our recovery was uneventful, which was great. And I must give kudos to the treatment that we received there. It's quite comparable to international standards. So today in June I'll be about 1 year post-transplant. And as you can see, I'm healthy, and I'm here to be a physical representation of what life can be like after transplant. And I wanted to let you know that starting hemodialysis does not mean that you have to live the rest of your life on hemodialysis. There is more permanent forms of renal replacement therapy that will allow you to live a more meaningful and a more lively life. Right now, steps are being taken to do that. We have a recently commissioned transplant suite at the Georgetown Hospital where transplant patients won't have to compete with other patients for resources. There's been, as mentioned before by Dr. Albridge, Transplant Act that has been commissioned recently in Parliament. And I know that we are in the implementation stages of introducing cadaveric transplant in Ghana, where a person who is brain dead will be able to donate their kidneys to two dialysis patients. So I'm telling you all of these things that are happening so that you're not asked to have hope in a vacuum. You're not asked to wait for a miracle to fall out of the sky. Steps are being taken to improve the quality of life for patients living with end-stage renal disease in Ghana. And I'd like to encourage you and echo the words of Dr. Baran to stay healthy, to try your best to follow the instructions given by your doctor, to ensure that you have the best quality of dialysis that we can offer. Because as was said by Dr. Baran before, the healthier you are prior to transplant, the better your outcomes will be after transplant. So you're not doing dialysis to do this continuously. You're doing it with the goal of eventually coming off dialysis. So I implore you to take it seriously. And I'm so overjoyed. I felt very overjoyed when I heard that this grant was being extended towards persons living with end-stage renal disease, because I'm aware of the financial burden that it is, because I've been through it. I'm aware of the emotional stress. I'm aware of the physical trauma it does to you and to the people that love you and care about you. So you're not alone. I'm also a member of the Guyana Kidney Foundation, where we take special effort in offering support to people living with end-stage renal disease. If you need someone to talk to, if you'd like to ask about other people's experiences, there is a wide community of people like me willing to offer our support in any way that we can. There are also a community of patients who have received transplants and donors. For those of you who may have donors that are scared to go through the process and they'd like someone who's been through it to talk them through it, we are here as well. So I hope that I can be a beacon of encouragement to you, and even something, and even I hope that my words are encouraging and it helps you to continue fighting, because you're not fighting in vain, you're fighting for a positive goal in the end. Thank you.
So the challenge that we have with end-stage renal failure is that nobody wants to get there. But unfortunately, a few patients would progress to that point where they would require dialysis. And if we think back, maybe about 18 years ago, we did not even have dialysis in Guyana. So over the last 18 years, we would have made a very important journey to where we are today. So one of the collaborations that we've had with the Pan American Health Organization is that we have been able to bring in some consultants. We had a first consultant a couple months ago who came in from Argentina and who is a nephrologist and has been running one of the largest centers in Argentina, came and she did a preliminary assessment of all our facilities here and has recommended certain standards. And the reason why we are doing that, because we want to make sure that when patients go to any one of these dialysis centers, that you can go there with the confidence that they are meeting certain standards, international standards, so that you know that the quality of care is guaranteed. And so we have had that assessment, and next week we are also going to have a second consultant that is coming from the Pan American Health Organization that would continue this work, and we'll be working with each one of the dialysis providers to ensure that these standards are kept at every single one of the dialysis facilities that we have in Guyana, so that you can ensure when you go there that you are getting good quality care. So that's one of the things that we are working on. You know, when we first started dialysis, the government started giving help to dialysis patients from 2008. But in 2015, that changed slightly, that patients with dialysis would receive a one-off payment. So when you were first diagnosed with end-stage renal failure, you were going to get $360,000, and that's it. The government wasn't going to offer you any more money because they just give you this one-off payment. And as you have heard from Dr. Barron, most patients cannot afford 3 sets of dialysis, which is essential if you are going to live a healthy life. So you need 3 sessions every week. And if only 30% of the patients are getting that, then we have a big problem. And 2 sessions, as he said, only 50% are coming for 2 sessions. So imagine the challenges that we have. So more people are only taking one session because they can't afford it, and eventually they get sick, they come in with all kinds of complications, and it's harder to treat those patients. So it's better to do take preventative actions by ensuring that all our patients are getting at least 3 sessions. And so we decided as a government that we need to seriously look at this and see how we can enhance payment. And I recall having this discussion with His Excellency the President, President Ali, and one of the first things that he said to me, bring a cabinet paper so we can have a detailed discussion at the cabinet. And I did so last year, and when we went through all the details, some of the same stats that Dr. Barron would have presented, His Excellency right away instructed our Finance Minister, Dr. Singh, to ensure that this becomes a measure in the new budget. And so it became a new measure in the new budget. And just to show you the magnitude, in 2020, we spent about 21.9 million Ghana dollars providing assistance for dialysis patients. And this year, we have allocated $180 million for dialysis treatment. And that is why each one of you would be getting a grant of $600,000. And this is not a one-off payment. This means that every year you will be getting 600,000 Ghana dollars to assist you with paying for your dialysis session. And we know even with that it's still challenging. So one of the things that we'll be working with Georgetown Hospital and your nearest regional hospital is that, as Dr. Barron would have said, you need to have blood tests almost every month. So those blood tests to monitor how you're doing and things like that, they're expensive. Because when you look at it, if you have to go to the private sector, it costs you quite a lot of money. So we are going to put some mechanisms in place to allow that the laboratory tests that you need to get done, that we are going to do that in the public sector. So one of the things that we'll be meeting the providers of dialysis is that when they're required to have laboratory tests done, that they can take the sample and send those samples to our labs, and that the public sector would then be able to do those tests for you free of cost. So that's another arrangement that we put in place. And then, as Dr. Barron was saying, one of the things that they monitor is your red blood cells and how much of that you have circulating. A lot of people end up with anemia and so forth. And one of the medicines that you normally would get, erythropoietin, that too is very expensive. I think some of you probably ending up every 2 weeks or 3 weeks, as the case might be, you have to pay another $7,000 or $9,000 depending on, where you're going to get it. And that too can quickly add up to a huge cost. So we have been strategizing how we can help you with that as well. And so we have decided that one way that we can help is that we'll put erythropoietin as part of the medicines that we'll be procuring for the country. And we'll budget to make sure that we are procuring enough for the patients that we have. And we'll make that available to every dialysis patient free of cost. So once your doctor is prescribing it, we'll make it available to you. So we are trying to work out the mechanics of that, but hopefully we can get that started by the end of the year as well. So these are little ways that we are trying to work with you to make sure that you can get good quality care. And we are hopeful that with this gesture, that obviously you will, pay more attention, come more often to the clinics, and make sure that you take your treatment. In another couple of months, we would be launching a program where all the patients with Hep C infection, we will start treating them, and the treatment that we'll be making available to them would cure at least 98% of those patients. So this would be another way in which we will work with you to make sure. Dr. Byron had said to me that probably about 10% of dialysis patients would normally get maybe Hep C. So if you get Hep C, that it's not you have to live with it. We'll also be able to treat you for that. So with those few words, and again thanking everybody for helping, I just want to say that we are extremely pleased to have you here this afternoon, and we look forward to working very closely with you as we help you to gain better health by complying and going for your dialysis session. Thank you very much.
I'd like to thank the government and the whole team for the 600,000 that they have granted us. It's doing a great help for us, and I will try to see how I can squeeze as much to get my session dialysis done. And thanks a lot once again.
A good initiative going on, and it can help me a great lot. I would say I hope it work out for me this time around, because my finance really go down instead of building up. So the government is giving something that beneficial to the patient.
I am very happy towards the assistance because I find it very hard to maintain Rodlin and then pay for this dialysis. But I know God is in charge, and at the time of need, He, in the time of need, He came to my assistance.